ladies in blue. We all came separate and we all dressed the same. So I don't know what that means, but
good minds think alike.
Yeah, maybe.
You know that I talk a lot about health, and I was saying to my friends that, of course, health at your age, and at my age is very different. What are the issues that your age group is talking about?
Well, I'm 33, so majority of my friends in my age group are thinking about having kids, or on their second or third child. I feel like the thing that we talk the most about in our friend group and also on BDA Baby is just overall burnout. And that's burnout with your kids at home, it's burnout in relationships, and burnout with trying to make everything perfect.
So when you go to your doctor for a checkup, or when you're talking to your doctor about burnout, are you talking to her about sex? Are you talking to her about pregnancies?
I feel like it's definitely hormones, pregnancy right now at this phase of my life. There's a lot of questions now when I go in about mental health. There's a lot more awareness and conversation about that with doctors, I feel like, and also in my friend group. Then I feel like you reflect on having that kind of conversation when you were our age.
Yeah, well, it's interesting because I know you were saying, well, I'm 33, and given my age, and I'm thinking to myself, I'm 32, and given my age, my friends and our conversations could not be more different.
Yeah.
A lot of my friends are working and trying to kind of figure out big life choices as to whether they want to freeze their eggs. I went in after you had a baby, and I went to my gynecologist, and I was like, do I need to be freezing my eggs? Like, how much time do I have? And I think I was 27 or just turned 28, and she was like, you have so much time, don't worry about it. I go in for 30, and she's like, so let's talk now about freezing your eggs. And I was like, hold on a second, I thought I had some time here.
You're talking about birth control, freezing eggs, infertility, pregnancy loss is a huge issue. Mm-hmm. How big is sexual health in your generation? Like when I was your age, I never went, well, first of all, I had a male OBGYN. I know that's shocking to both.
I cannot even imagine. I just don't, to me, it's also like you want somebody who's able to relate to
well, there
how
weren't,
you're feeling.
I agree, but I know what you were like, I can't believe you. I was like, well, there were no women, OBGYNs at the time. I remember well after having 4 kids, I talked to my OBGYN and he said, how's your sex life? And I was like, oh my God, I want to talk to you about that, But you guys speak pretty openly about all of that, right?
I mean, we speak openly about it, but also, we've spoken to you about those things, and that's definitely generational differences because you would never have talked to your mom about that.
Never. You, Christina, have done these films, one dealing with Adderall, one dealing with Xanax. How big are those issues in your age group?
Yeah, I mean, the movies also sprouted out from my personal experience with medications. I knew I wasn't the only person going through those experiences. I think that the mental health landscape has evolved so much just even within the past few years, and the level of awareness is amazing, and so now we're able to have conversations around these topics without the kind of weight of, am I being judged?
Girls in their 30s talk more about being old than I do.
I mean, we are really lucky that we have, we look at you and I'm like, that's goals, you are very on top of your mental health, your physical health, your spiritual health. I think, you and Dad both are incredible examples of people who are aging with grace and doing it really, really well.
Do you feel like that we have an open communication about your guys' health journey?
Super open.
Yeah. Yeah. No, I agree.
And I think also we're really lucky to be able to have open and honest communication with our mom.
Oh my gosh, talk about goals. Okay, here with some advice for women in their 30s is Dr. Lisa Larkin, a women's health internist. How are you?
Great, thank you. So nice to be here.
It was so interesting listening to Maria's conversation with her daughters. And one of the issues that seems to come up a lot in that age group is to freeze or not to freeze when it comes to eggs. What's the best advice there?
Right. So I think the first thing is for women to kind of pay attention to what their own hopes and dreams are, right? So is fertility and having children even something you want to begin with? But what we know is ovarian function and pregnancy and fertility is somewhat time limited. Mm-hmm. So women really do need to have a plan and start to think about whether or not they want to have children. At about age 35, fertility starts to go down, and age 40, it goes down a lot. And so in the past, we didn't have great egg freezing. We really had embryo freezing. Now the technology's improved. We really can freeze eggs quite well. And we know that the best time for a woman who wants to delay pregnancy till 40 or late 30s is really to do egg freezing between about 30 and 37. That's when you have the best chance of having high quality eggs that will result in a pregnancy.
One of the other things that Maria and her daughters discussed was mental health and burnout. What's advice, you know, when people come to speak to you and women come to talk with you about that? What's your advice?
Right. So the first thing, I think that is so highly prevalent, and I am seeing that so much in practice now, particularly post-COVID, right? The level of anxiety and health concerns has really increased. I think the first thing is really to understand if it's a short-term, relatively situational issue that you can work out with healthy lifestyle habits and social connection and exercise and diet, but certainly to be aware that hormonal influences really affect mood. There are peak times in a woman's life when she has mood disturbances. We know it's puberty, postpartum, the perimenopause and menopause transition. And if mood disturbance is becoming pervasive to the point where it's long duration, it's interfering with your relationships, you're not sleeping, you're eating, you're gaining weight, that's when really, again, a mental health professional is really helpful. And that's when really you might consider starting to discuss medication. And medication doesn't have to be antidepressants. Sometimes we really get great benefit out of continuous oral contraceptives and other forms.
Women are spending so much time in their kind of 20s and even in their 30s having the conversation about how not to get pregnant. And then all of a sudden,
it's time to get pregnant.
It's time to get pregnant. What are you seeing from women today in their 30s? Are they struggling to get pregnant? I hear so many more stories about that today.
Right. Well, so certainly infertility is really directly related to delaying pregnancy, right? And so certainly as women are waiting longer to have children, we see more infertility. I think the discussion really has come back to younger women, and this egg freezing has really become much more common. Many employers are now paying for it in the workforce for young women, which is really a great thing, but not for everyone, right? So it's expensive for some women, but it's something that women should be talking about and their doctors should be talking about.
I just love the two different stages that your daughters are in, and there should be no shame about finding your own way.
That's right. But that's what I think is so great, is that they can both be kind of 19 months apart, totally different tracks, and be talking about totally different things. So when my daughter asked me about egg freezing, I was like, I don't know, because that wasn't around.
That wasn't around. That wasn't a thing.
So you're saying start talking to your daughters at 30.
Right. I mean, so, you know, in the 20s, I mean, you know, you're aware of 20s, you know, do you want to even have kids? Are you in a relationship? Are you playing it? Like not everyone wants to have children, and then thinking about it in your early 30s.